I'm Michael Bloom, Chiropractor. Thanks for watching. So the question is, what makes chiropractic? Because in the day and age we're in, there are many options that people can seek if they're looking for a healthcare practitioner, especially in that space to do with dysfunction, discomfort, pain, etc. And chiropractic is one of the options, and there are many other options out there. So this is just purely my perspective, what actually is it that makes chiropractic, or what are the unique factors that make us different to the other professions? And each profession probably has a point of difference, such as physiotherapy, osteopathy, etc. But from a chiropractic perspective, that's the one I feel I can talk about because I am a chiropractor. That I believe that the fundamental point of difference and the part that really is a foundational, base to what we do, it comes about through how we look upon the structure of the spine, and the fact that when we're looking at the spine, we're respectful of the fact that the spine is so closely related to the central nervous system and the nerves which are exiting and entering from the small spaces between the vertebra. And that chiropractic ultimately and historically has paid respect to the fact that there's that relationship, and that what we do and what we work on is to a large degree geared upon trying to influence positively that relationship. Then to expand from there, the nerve system and the nerves themselves, they connect through to the rest of the body. So the better that the spine operates, and the better that it can protect and house your central nervous system elements, then there's just an assumption or a logic to the fact that can and may influence positively the rest of your holistic picture of health and well-being. One of the other aspects that chiropractic originally was founded upon was the method. Now, the method of chiropractic has always been hands-on. Chiropractic, broken down into its root description, is done by hand. Chiropractic's always been done by hand. There's no surgery, there's no recommendations of pharmaceuticals. And so that's another fundamental differentiating factor that chiropractors have held on to over the last 125 odd years. So whilst each profession can play a role and have different influences, I think it's really important just to mention that probably one of the most differentiating factors is just the view we take upon what we do and the implications therefore, and that can then lead into a variety of different treatment options, recommendation options, and in some cases really opening people's minds to the fact about that relationship and how influential it can be. I hope that's been of some use to you and provided, if need be, a level of understanding that you may not have already had. Wherever you are, have a great day, and we do look forward to helping you if we can, anytime from now into the future. Cheers, take care.